Okay, my name is Ronnie Aradi, and today I'm going to take you through this amazing product that is previously launched in this company called BF Suma. So, this product is called the GLUZOJOINT Ultra Pro, and it solves a number of problems. For example, among 50 people over 50 years old, osteoarthritis is the second leading cause of the long-term disability after the cardiovascular disease. Also, osteoporosis is the second most prevalent disease in the world. Therefore, it means we should pay more attention to the bone health. Right, so let's see what is osteoarthritis. Osteoarthritis is a degenerative joint disease. It can cause pain, swelling, and stiffness, affecting a person's ability to move freely. Osteoarthritis affects the entire joint, including the surrounding tissues. For example, as you can see on my picture here on my slide, is a joint which is connected the upper bone and the lower bone. As you can see, on the sides of your joint, we have what we call the capsules. Now, the capsules are meant to hold your joints together. And then inside your joint, you also have what we call the synovial fluid. Now, the synovial fluid, its main purpose is to lubricate the joint. On my first picture, it shows a healthy joint, which has the healthy capsules. It also has the healthy synovial fluids. And also on top of your bone or your joint, there is what we call a soft bone, which is called the cartilage. Now, the cartilage, its main purpose is to smoothen. It offers a smooth surface for your joints. So, on the second joint, it shows someone who is affected by osteoarthritis. Now, the roughening of these cartilages has caused these bones to be attached together, and the roughening and the what you call the friction or the rubbing has increased. Now, when the rubbing increased, there is what you call the inflammation, and when there is an inflammation, it makes you to feel pain on your joints because your joints are now at a high temperatures, and also it has caused what you call the wear and tear on your joints. And when wear and tear occurs on your joints, it means the synovial fluid also starts to dry up. You will not have enough synovial fluid. And then the last photo here shows a rheumatoid arthritis, whereby there is what we call the bone erosion, and then the swollen, inflamed synovial membrane. This one also causes a lot of pain on your joints. Now, as you are experiencing this kind of issues, it means that you're having what we call the osteoarthritis. Right. So, what are some of the causes of osteoarthritis? So, cause number one, as age increases, there is insufficient of nutritional supply to the cartilage and an increase in organic substances in the bones, leading to a reduction in the elasticity and toughness of the skeletal system. Therefore, it means when someone is growing old, the nutritional supply that is supposed to be supplied into your bones or the cartilage reduces, and when it reduces, you are more exposed to what you call osteoarthritis. And then cause number two to osteoarthritis here is the chronic strain on joints and an acute injuries resulting from improper exercise methods can also increase the risk of developing osteoarthritis. So here we can talk about maybe sports people or someone who likes what we call the hiking, exercises, activities, and all that. So if you do activities that exceeds your body limit, you are much exposed to osteoarthritis. For example, if you're doing hiking without using or maybe you are carrying a lot of luggage, or maybe you're using the shoes which are not sport shoes, it means you're straining your bones. And then when you're straining your bones, you'll get what we call osteoarthritis. Also, we have another cause of osteoarthritis. This is the third cause. Compared to individuals with the normal weight, those who are overweight or obese will face a higher risk of osteoarthritis. All right. Now, when someone has obesity or this person is overweight, it means you're exerting a lot of pressure or a lot of weight onto your joints, because your legs, of course, are the ones that carries your body. So if you are overweight, it means you will expose yourself to osteoarthritis. And then cold weather is common trigger for recurrence or worsening of the disease such as osteoarthritis. So it is important to keep the joints warm. So this is another very common disease that you can see these signs which are commonly, if you want to know someone is affected by osteoarthritis, you'll find that this person during cold, it is when they are feeling a lot of pain during the cold season. So we should also keep our joints warm. All right. Then we have excessive strain on the joints, such as engaging in activities like climbing or stair climbing can lead to mechanical wear, damage in cartilage, to cartilage and development of osteoarthritis. This one I had explained earlier. When you strain yourself so much or doing tedious activities, it strains your joints and then you get what we call the osteoarthritis. Well, so some of the parts that are affected by osteoarthritis, we have what we call the hip joint, the knee joint, the hand joint, foot joint, and the spinal cord. Now, these are some of the common areas whereby osteoarthritis affects our body. So if you're feeling pain on your wrist, you can be maybe of late you've been doing a lot of strenuous activities which involves your hands. And then the knee joint, maybe you can talk of maybe something like hiking or sports activities and all that. Hip joint, you can also talk about physical exercises. Foot joint, maybe walking. Spinal cord, can also talk about carrying heavy luggage and all that. It exposes you to osteoarthritis. Right. How to test yourself? How do you know that you have osteoarthritis just at home? Number one, in the acute stage of arthritis joint, redness and swelling often occur and temperatures are high around your joints. So you'll see that your joint or the place that is affected, it is red in color, and then there is high temperature at that place. Number two, you have what we call the swelling. Now, swelling is a common symptom of arthritis and it indicates acute onset of arthritis, but it is not necessarily related to the degree of joint pain. And then stiffness. Joint stiffness is in the morning, which can be relieved after exercise, often indicates that it is related to the cervical spine. If morning stiffness lasts for more than half an hour, be alert to the possibility of rheumatoid arthritis. So stiffness is that condition whereby your joints are not able to move or to feel free. What term am I using? Okay, your joints are flexible. Now, when your joints are flexible, it means you can do any activity. But when you're waking up in the morning, for example, for the sports people, they call it muscle pull. Now, the muscle pull is that situation whereby your muscles are strained and I don't know which best term to use, but you understand. The joints, okay, the muscles are strained and they cannot be flexible to do any sort of activity. And then the hotness, because the joints have very little blood supply, they should feel close to body temperature under normal circumstances. If the joint skin temperature increases or even becomes hot, it indicates the presence of joint inflammation. Remember we said on your joints you'll have what we call the inflammation when osteoarthritis is set on. And then lastly we have what we call pain. This is the main manifestation of arthritis. Joint pain can be caused by various reasons. If it is accompanied by redness, swelling, and heat, you need to seek medical treatment in time. So this is how to test yourself uh, and to know whether you have this arthritis or you don't have it. Good. Now, how to prevent? We have a number of factors. In this case, we have 5 ways in which you can prevent osteoarthritis or the bone problem. We have what we call the weight control. As we talked earlier, your weight exerts a lot of pressure on your joints because your legs, of course, are the ones that carries your body weight. Therefore, losing weight can reduce the load on hip joint, knee joint, and other lower limb joints in daily life and daily joint fatigue. And then you have what you call reasonable exercises. Exercises scientifically are and rationally control the total amount of exercise and short-term exercise increments and adapt the principle of gradual increments. So you do a reasonable exercise. Don't overdo the exercise. We have those people who like to go to the gym. Now, when you go to the gym, don't overdo yourself because of you're showing up to your people that you can do this. Okay, so do something which is reasonable and moderate. Don't overwork your body. Right. We also have avoid overloading your joints. Avoid sports that overloads the joints. This means, yes, you are in sports. For example, you're in javelin, you're also playing maybe rugby. Let me use rugby as an example. Rugby, it is a type of sport that needs more strenuous activities or yeah, I usually see rugby people when they are training. It is really strenuous. So that can be something that can expose you to this uh, overloading your joints. And then we also have number 4, we have strengthen muscle around joints. Choose appropriate exercise methods such as straight leg raises, wall squats, etc. These ones will help you strengthen muscles around the joints and then avoid the damage. Joint injuries can damage the meniscus, ligaments, and the cartilages, leading to premature osteoarthritis. So these are 5 ways in which you can prevent osteoarthritis. Then we have the raw materials of this product that we talked about called the GLUZOJOINT Ultra Pro. So it has the glucosamine hydrochloride, which promotes the formation of bone, organic matter, and the combination of inorganic matter. It also improves the psychological and motor functions of joints and the surrounding tissues. Then it also improves and enhance the viscosity of synovial fluid. This glucosamine also prevents the collagen denaturation. It also lubricates articular cartilage layers. So these are five benefits of the glucosamine hydrochloride helps to nourish your joints to avoid those pains, the roughening of the cartilage and all that. All right. So the raw materials, for example, we also have another one called the chondroitin sulfate. Now, chondroitin sulfate, this is another raw material that is found in GLUZOJOINT Ultra Pro. It inhibits the enzyme activity. For example, it exerts its effects by inhibiting the activity of cyclin-dependent protein kinase and signaling protein kinase, reducing the nuclear translocation and transcription factors, and decreasing the activity of proteases, inflammatory inducible enzymes, and the synthesis of pro-inflammatory cytokines. So this one also helps your joint. Then we have hydrophilic adsorbent to water, absorbing fluids into the joint cavity, maintaining the hardness and load-bearing capacity of the joint, and inhibiting the activity of osteoclasts, lubricating the joints and reducing wear. So that is the function of chondroitin sulfate. And then we also have the calcium fructose borate. Now, the calcium, we all know the function of calcium. Its mineral compound clinically are validated to improve joint comfort in just 2 weeks by promoting your joint health. That means it has patented ingredients and the soothing factor. And then sodium hyaluronate. This one, it has 6 national patents and the Ultra HA Huaxi biotechnology. It has the function of moisturizing, lubricating, and nourishing the tissues and organs of the human body. It can effectively remove harmful enzymes and various harmful factors in the joint cavity. All right, so that is the presentation of this very amazing product that was recently launched, and it is an amazing product that one can be able to use and get healthy joints and ease the issues of osteoarthritis. Therefore, for you to get this product, kindly grab my number on my bio, or you can just comment on this video down there on comment section. Just comment with maybe I need this product, and then I reach out to you regardless of the place you are. All right. Also, you can also ask questions on the comment section so that I understand which area do you need to understand deeply and how can you be assisted. All right. So watch this video. I believe this video will be helpful and beneficial to you as health matters are concerned. So have a wonderful moment.